You have to have questions to be answered which will be focusing on the levels of plasma lipids. So on the right, I will write you something about the levels that are required to be known as numbers. This is lipid profile in the plasma, and these are the normal parameters, or simply called as reference intervals. If a patient comes to you for a lipid profiling, these are the values to be taken into consideration, and these are the parameters you have to test for. First one is triglycerides. In case of triglycerides, if you have males, their value should be approximately 50 to 150 milligrams per deciliter. In case of females, it will be 40 to 140 milligrams per deciliter. Technically speaking, it should be less than 150 milligrams per deciliter for both of them to be having a very safe and comfortable life. Next, we focus on the next parameter called as Hdl cholesterol. Now, this should be higher the better. In case of males, value should be 30 to 60 milligrams per deciliter, and females should be showing slightly on the same range of values. It should be 35 to 70 milligrams per deciliter. What about LDL cholesterol? See, some students can ask me a question: is HDL cholesterol and LDL cholesterol different? What is the difference in the cholesterol? It's not about the difference in the cholesterol. It's about how much of the cholesterol is that particular package carrying, and where is the package carrying it to. HDL will collect cholesterol from the peripheral tissues and give it to the liver, who can actually take care of it well. LDL cholesterol will take the cholesterol from the liver and give it to the peripheral tissues. Both are supposed to happen. But if LDL is more, it means more cholesterol is shifting from the liver towards the peripheral tissues, because of which peripheral tissues cannot be able to handle extra of it, because of which you can have disorders. So remember, even extraordinary amount of HDL can also be dangerous for you. For the time being, you have to remember that HDL cholesterol is good cholesterol because it shifts cholesterol from multiple other tissues to liver, while LDL cholesterol is shifting the cholesterol from the liver to the other tissues. Here the LDL cholesterol levels will be unique for many people, which is 80 to 140 milligrams per deciliter. So we give them a very wide range. Then what about total cholesterol? Total cholesterol should be less than 200 milligrams per deciliter, and phospholipid content should be again less than 200 milligrams per deciliter, but it should be more than 150 for sure. It is also important for carrying out HDL activities. When it comes to free fatty acids, what is a free fatty acid? The fatty acid who has not been used for any esterification reactions. So free fatty acid concentration should be between 10 to 30 milligrams per deciliter. These are the values that you should be knowing when you try to answer any kind of case discussion with respect to the lipid profiling. Okay.